training providers in Singapore are saying that interest to learn how to provide mental health support to peers is staying strong after rising during the COVID-19 pandemic. For more on what para-counselling entails, we're joined by Andrew. He's a clinical psychologist who is an associate trainer at the Academy of Human Development. Thanks for coming in, Andrew.
No worries.
Now, para-counselling, how different is it from someone like yourself? You have a master's in clinical psychology.
Yeah.
If I took a certified course in para-counselling, how would that make me different from yourself in terms of being qualified to counsel?
Yeah. So think of para-counselling as like a first aid kit in that sense. We provide basic information and basic way of like connecting with people, listening to people, providing empathic listening. So all of these skill sets are what we call as basic counseling skills. And these are ways to help people who are maybe in distress or need a listening ear. So this is very different from, let's say, my job as a clinical psychologist or counselor, because that's where we have extensive training to help with maybe a bit more of moderate or even higher risk of mental health issues.
So in other words, say someone like yourself, when your workload is excessive, that would you would then see the point of having para-counselors who might take on, from your point of view, perhaps less onerous duties, less potentially dangerous duties as well.
That's right.
Is that the function of para-counselors?
Yeah. And what they can do is they can provide emotional support, social support, and even be like a way of triaging to see if this is a case that needs maybe even more support. And if they do, that's when they could, say like, hey, maybe you could go to a clinical psychologist or a counselor as well.
Now, earlier on, we ran a report. One of my colleagues interviewed a lady who said she felt that signing up for courses in para-counselling helped her learn how to ask the right questions. Now, it can make us more empathetic as human beings. Maybe the way we speak to our family, our co-workers might improve because we're more aware of boundaries of what we're really asking when we ask a simple question. But say if we actually use them in a workplace, say in school or in a workplace like this, what place do they have?
So let's think of it from a perspective where your colleague is going through a really tough time. And at the point of time, they would want just someone to maybe rent or talk about certain issues. And at the point of time, because you've gone through a course in para-counselling, you're able to ask them the right question where we move beyond renting and asking them what's truly affecting them and what type of issues might be causing them trouble. And that's when we realize this is more than merely being a sad day or a bad day for them. There might be deeper issues in that sense. And that's when we're able to say, hey, I think that, some of the things they're saying, you may need a bit more of a support. Could you then go to...
So it makes us better listeners, better friends, better colleagues.
Yeah.
But should we want to make more of this? So say really as an aid, for example, to someone like yourself. Is it in any way irresponsible to say, well, you've just done some certified course in para-counselling and now you are equipped to take on, I suppose, the responsibility of people with genuine mental health problems?
That's right.
Is that a danger that you might see arising from this?
Definitely. Because if we want to go back to the boundaries of para-counselling, if we're teaching them simple basic counselling skills, such as, once again, teaching them empathy and listening skills, that is not enough to handle people with greater mental health issues. So they are there, again, once again, to provide like social support.
So first aid.
Think of it that way. That's right. Mental health first aid.
But from there to getting better or perhaps more universally accepted as a counsellor, what's next? What can you do?
I think if someone did maybe a course in para-counselling and they said, this is something for me, that's when they should go through a formal education, right? So either going through a master's in counselling or then going through a master's in psychology, and that would be helpful for them if they want to further support people with moderate or even severe mental health issues. All right.
Where your organization, now that offers... it's a private education institution that offers training and consultancy for professionals and just anyone, even like myself, who's not a professional, but thinks I might like to improve myself one way or another. So you offer this course. It's called Basic Counselling.
That's right.
Earlier in that report by my colleague, the lady, she also interviewed someone who also offers courses in another organization. And looking online, you can see quite a few different centers offering accreditation schemes, certified schemes.
That's right.
Do you see emerging right now in Singapore, given this huge stress on mental health, a way to regulate, standardize what we consider proper or accepted certification on counseling?
I believe there is not a necessity right now in terms of like there is no formal way of go about doing it. But what we could do is look at the causes. So for example, at least for AHD, where I'm from, it is WSQ certified, and it's also from the skill set future as well. So because of such organizations coming in, and we also have lots of trainers who have been in the industry for years. So if we have such, things that are helping us out, I think that'll be very helpful. Think of it as safeguards.
All right, all in the greater scheme of improving how we manage stress in our mental lives. Thanks so much for coming in this evening. That's Andrew, clinical psychologist and associate trainer from the Academy of Human Development. Thanks so much for coming in this evening.
Welcome.